Hi, I'm Steph Castile, and I'm a Williston State ADN student. And today I'm going to demonstrate inserting a catheter, running fluids, flushing a saline flush, and then discontinuing an IV. And so I have just gotten my doctor's orders, and I've got Shirley Coast, 4/3/1987, for administration of lactated ringers via IV, checking it with the mark, Shirley Coast, 4/3/1987. And so now I'm going to go into my patient's room. Close the door for privacy. Hey Shirley, I'm Steph and I'm going to be your nurse today. How are you doing? Don't feel too good? Yeah. So since you were admitted with dehydration, the doctor has ordered IV solution for you. And so I'm going to go ahead and put a catheter in. Is that okay? All right. Can you verify your name and date of birth, please? Shirley Coast, 4/3/1987. And can you also tell me what you're allergic to? Codeine? Okay. And so I'm going to go ahead and go get all your stuff ready, and I will be back to do your IV. So I've left the room, and now I'm in the med room, and I have gotten the IV, and it is in a bag, and there is no fluid floating around in the bag, and it is lactated ringers. And so now I'm going to go ahead and gather my supplies and go into my patient's room. So I'm in my patient's room, shut the door, do hand hygiene. All right, Shirley, I am going to go ahead and get your IV fluids ready, and then I'm going to insert your IV. Can you verify your name and date of birth really quick? Shirley Coast, 4/3/1987, perfect. All right, and so I've taken the IV solution out of the bag. There's no discoloration, there's nothing floating in the bag, and there is no rips or perforations in the bag. And so I'm going to go ahead and not hang that there. And so I've gotten a new bag of IV tubing, and so I'm going to go ahead and prime my line. And this is sterile, so I'm going to make sure that I don't touch this on anything when I remove the cap. So I'm going to remove that. Remove the cap. And so when I go to swipe this, I'm going to insert it smoothly and twist at the same time. Then I'm going to flip it over and open up this. Make sure this is halfway. And because, just for video purposes, because I've done this with this same tubing, I'm going to go ahead and squeeze the bag to get the fluids running through. I'm going to take this cap off, and the fluids are going through, so I'm going to put the cap back on as I did not touch that. And I'll go ahead and clamp this, and that is finished. All right, Shirley, so I'm going to perform hand hygiene, and I'm going to go ahead and get you ready for your catheter or your IV. And what hand do you normally write with? You right? So is it okay if I try your left arm? All right. So I'm going to just go ahead and take a visual look. All right. go ahead and grab a couple of pieces of tape. Okay, so I am going to place this tourniquet around your arm because I want to make sure that I start low with the IV instead of going high. And it's you're gonna feel a little bit of discomfort, but you shouldn't feel a pinch. So I'm gonna look at her veins. You got two pretty good veins right here. Okay, I think I'll go with this one. So I'll go ahead and take that off. And this is IV prep, and so I'm going to squeeze this to activate all the stuff inside. I'm going to start in a circular motion, working my way out. And this also helps get the vein all plumped up, get the blood moving to the surface. I want to do this for 30 seconds. For video purposes, that's 30 seconds. Okay, so I done hand hygiene. Now I'm going to put on some gloves. I'm going to go ahead and get my flush ready. Take the cap off, pull this back to release the pressure. Air out. I'm gonna go ahead and hook this up. Make sure this is unclamped. I'm gonna go ahead and loosen this. And go ahead and flush that through. And clamp that off. And this is ready to go. I would have taken off my gloves and had all my stuff ready. And I came back, had hygiene, new gloves. I'm gonna go ahead and pull my needle out, get that ready. And get this ready. Okay, all right, Shirley. So I'm gonna apply the tourniquet one more time. And if this was an older client with fragile skin, I would use a blood pressure cuff instead of a tourniquet just for not damaging the skin purposes. And so I'm going to open this up. And I want to make sure that the bevel is pointing up. And I'm going to go into the vein. I'm going to hold pressure right down here. And I'm going to go into the vein at about a 15-degree angle. And on the count of 3, Shirley, you're going to feel just a little poke. 1, 2, 3. And then I'm going to go ahead and put it down closer to the skin. And I'm going to advance the catheter. And I see a little flashback. And keep advancing the catheter. Now go ahead and let that out. Now I'm going to apply pressure. All right, and keep the catheter stable. And I'm gonna hook up the flush. I'm gonna go ahead and keep this stable and go ahead and flush, and it's patent, the fluid's moving through. All right, while this is hooked, I'm going to grab some tape to stabilize the catheter. And then I'm going to take my Juvederm. Oh, I did it the wrong way too. Jeez. Okay, well that would have gone more nicely had I followed the directions more carefully. Okay, so that's all nice and secure. I'm gonna run one more right over. Make sure I don't cover the hub. I'm gonna go ahead and disconnect my flush. I'm gonna secure this up here and make sure that I don't get it over the IV site, because when we come in to do the checks, I wanna make sure that I can see that vein and see what's going on with the skin around it. Okay, so that's done. I would make sure that this goes into the sharps. This goes into the garbage. I'm gonna go ahead and do my labeling. So for the IV site, I use 18 gauge needle, insertion date, and my signature. And I want to make sure that I put this on the side, again, the side of the vein. So we don't want to cover that. And I'm going to label her IV fluids on the clear part of the bag. And I am going to hook her IV fluids up now. I'm going to go ahead and run this for about 15 seconds. Purposes of video, that's 15 seconds. Alright. And I'll take another piece of tape, just because I want to make sure this stays out of her way. Take this, and I'll just take it up here so it's more comfortable. All right, and then I'm going to go ahead and unclamp everything. And the fluids are running. All right, Shirley, are you doing okay? Okay. Well, I will be back here in just a little bit, just to check on you and make sure everything is going okay. And so I would make sure that I did hand hygiene and went and documented how the site did, how the client did with the site, if there's any redness, pain, and the gauge needle that I did, the time that I started the fluids, and so upon that, when I'm charting all that, I get an order that says now I can discontinue the IV fluids because the amount that she had was just enough to make her feel better. And so I'm gonna go back into my client's room. Hey Shirley, how are you doing? Hey, so doc said that we can discontinue the IV fluids. can you give me your name and date of birth? Shirley Coase, 4/3/1987, perfect. All right, and so I am gonna go ahead and top off fluids, just so they can stop running. And untape this. And get the flush ready. Again, pull back so there's no air. And so I'm going to unhook her fluid. Do this for 15 seconds. Video purposes, that's 15 seconds. We're gonna go ahead and hook the flush in. We're gonna go ahead and flush all that fluid, that IV fluid in to her arm, just like that. Lock that off. And so that is flushed, and so I'm going to perform hand hygiene. And did you feel any pain with that, Shirley? No? Okay, good. And so then I'm going to leave the client's room, make sure that I go back and chart exactly, you know, how the flush went, that her skin was good, it wasn't red, it was patent. And so while I'm charting that, I get another order from the doc that says, okay, now you can get rid of her IV. And so I have gotten my things. And so, hey, Shirley, I need you to verify your name and date of birth, please. Shirley Coase, 4/3/1987, perfect. And so doc says that we could discontinue your IV. And so I'm gonna go ahead and get a piece of tape ready. Okay. So I'm gonna fold this in quarters and put it between my fingers. And I'm going to go ahead and loosen all the tape, and man, it's coming off really good, Shirley. I must have used really good tape today. Except for that spot. I'm gonna make sure to put all the tape up to the hub. And so I've gotten that far, and so I'm gonna take this gauze and I'm going to put pressure here, and I'm gonna pull the catheter straight out to the vein, and as I'm gonna apply pressure, and I'm gonna look at the catheter, and it is intact. And so I'm gonna put this in the sharps, and then I'm gonna go ahead and look. And she's not bleeding bad at all. And so I've gotten a new gauze, put it in quarters. And put some tape over this just for breakthrough if there is any. And I would also, you know, if it was bleeding more, I would have her apply more pressure. If she was on coagulants, I would have her, or I would apply more pressure. And then I would make sure to document everything. And today went so fast that I did not have to label my tubing because all the orders were in one day. But I would definitely label my tubing because that is important. And so, yeah, Shirley is good, and that's it.